Thank you for joining us for today's RF Breakthrough session, Back to School, Keeping Students Safe in the Time of Delta. My name is Andrew Sweet, and I'm the Managing Director for COVID-19 Response and Recovery at the Rockefeller Foundation. And today's topic could not be more relevant, and perhaps no topic could be more consequential. 4.5 million children have tested positive for COVID-19 since the onset of the pandemic, and this is growing at over 100,000 per week. Last week, children were 18% of reported weekly COVID-19 cases. As of this week, schools will have opened their doors for roughly 62% of K-12 students, but keeping them open is another challenge. It is also frustrating given the evidence that now exists for how to safely reopen, some of which you'll hear about today. And sadly, in these first few weeks, we are already seeing schools close due to a lack of proper mitigation strategies, and it is happening across the country. In suburban Atlanta, 50 students and staff tested positive for the virus, forcing over 800 students into quarantine. In Indiana, an initial 70 cases triggered over 1,000 quarantines, and the district has now adopted a mandatory masking policy. More recently, in Arkansas, a district with 4,000 students had over 800 people in quarantine after 43 cases just 2 weeks into the school year. So today we will hear about how we can prevent such outbreaks and ensure our nation's students can safely and sustainably return to school. We're very, very fortunate that we have 4 distinguished panelists who have dedicated much of the past year to developing an evidence base for a safe return. All 4 have been resilient, insightful, and somehow optimistic partners of ours since the very start of the pandemic. We have Dr. Heather Schwartz, who's the Director of Pre-K to 12 Education Systems Program and a Senior Policy Researcher at the RAND Corporation. She has a PhD in Education Policy from Columbia and is the lead author of the RAND survey that was released this morning and that we'll get into in some detail shortly. Dr. Ava Stone is the Manager of District Health for Jefferson County Public Schools and an adjunct assistant professor at the University of Kentucky College of Nursing. She has worked in public school health for 2 decades. Dr. Mark McClellan has been with us since day one, answering emails and calls at all hours of the day. Mark has many titles, one of which is the director of the Duke-Margolis Center for Health Policy. He is an MD, PhD, former administrator of CMS and commissioner of the FDA. And Dina Hasiotis is the senior advisor to the superintendent of New Orleans Public Schools. Since last March, Dina has coordinated the district's COVID response. Dina proudly started her career as a 7th grade teacher in New Orleans and has degrees from Harvard and Syracuse University. So thank you all for joining us today, and thanks to the audience for listening in as well. Today we'll hear about the direct experience of 2 districts that have been planning for this reopening moment for months. Louisville, who has been open for 1 week today, and New Orleans, where many schools have been open now for 3 weeks, and all schools are now open for in-person learning. We will learn about the science behind the Delta variant and how it's affecting reopening. And we will get an overview from RAND on a July survey whose results were released just today. Will students come back? I think let's go to Heather first. So Heather, ground us. The question that you asked in the survey, will students come back, is perhaps the most asked question in the entire country. What did you learn from the survey? Did anything surprise you? And what has changed with the introduction of the Delta variant? And also would love to hear a little bit of the background of why you conducted the survey in the first place. So over to you, Heather.
Okay, sure. Well, there were some results in the survey that surprised me. And just to orient listeners to what we did, we surveyed a little over 3,000 parents in a nationally representative survey that we fielded from July 16 to July 29. So if you cast your mind back to ancient times of July 16, that was, by that point, Arkansas had had a severe outbreak. Cases were rising again nationally in the United States, and the Delta variant had become a household term. It had not, subsequent to the survey, we've seen even steeper increases and more outbreaks in Louisiana and Florida and other states. But by that point, the Delta variant had taken hold and had become the dominant reason that cases were climbing. So, given that context, that we captured a moment in which Delta was becoming the dominant story about COVID-19 and spread, I was somewhat surprised to see that a higher percentage of parents in July, so 89% of parents specifically, said that they plan to send their children back to school in person in fall 2021. That was compared to 84% of parents who planned to do so when they took a similar survey that we fielded in May 2021. In May 2020, the reason I was surprised is because by that 5 percentage point increase was in May 2021, caseload was much lower. However, obviously, parents were coming off an end of a long and chaotic and difficult year. So, but somewhere between May and July, undecided parents had swung in favor of sending their kids in person. And the main reasons, because we asked a series of questions to parents about why they were choosing to send their kids in person, and if not, why not? And the main reasons that they said they wanted their kids to go in person was because their children do better academically in person, they do better socially at in-person school, and that their kids themselves wanted to go in person. So those were the three top contending reasons for going in person. So we heard pretty strong endorsement from parents for that in-person provision, even in spite of serious health concerns that the parents also voiced on this survey. To get to your second question, Andrew, why did we field this? This was in response to state leaders in the State and Territory Alliance for Testing, or STAT for short, who had been wanting to get updated data about parents' attitudes to help inform strategies and communication for COVID-19 testing in schools in particular. And the facts on the ground have just been changing so rapidly for schools all throughout this pandemic, and the summer, unfortunately, has proven to be no different.
Great. Thank you, Heather. Ava, over to you in Louisville. You have literally moved mountains to prepare for this return, and you have been in back to school 1 week as of today. What is in place today that wasn't in place at this time last year, or even in the spring? And any reflections on what to do or not to do for districts that are not yet open?
Yeah, so we didn't open to in-person last spring until March. And so when students did come back to in-person learning, it was a hybrid model. So we had about 60% of parents opted to send their children back to in-person learning in the spring. And then of those, about 30% were there on 2 days a week, and then the other 30% the other 2 days a week. So that made mitigation factors much easier to implement because we had fewer children. So when we opened last week, it is full. Everybody's back 5 days a week. And so we knew we were going to have some pretty significant challenges in doing that because we have mitigation factors in place, but obviously it's going to be more difficult to socially distance, for example. And so we were fortunate, our board, there were some changes in the guidelines. The state had some factors, some measures in place for schools that ended at the end of June. And so there wasn't a state guidance document that told districts what to do. And so at this time there is one, but our board had voted on a plan for returning to school, and they implemented, for example, universal masking before. Since then, our governor has come out and supported that for schools, but we didn't have any of that when we were making our back to school plans. So it was challenging. There was a lot of pushback on the universal masking, but we knew it was going to be important because we were bringing roughly 97,000 children, 15,000 employees back to in-person learning. And so, of course, there's hiccups with that. We've got busing issues to figure out. We're still working with the schools. I think that what I would tell school districts is to make sure you've communicated with your schools and remind them those prevention factors, the social distancing, the masking, those things that they can do to help. We've been using the phrase, stay apart, and keep a chart. So we want them to remember to social distance as much as they can and to keep seating charts so that we can reduce the number of children we have to quarantine when they're exposed.
Great. And can you maybe just talk a little bit about the role of testing? I know that, we have this partnership with HHS and the White House and Abbott. So you've been kind of ahead of the curve on that. What are you doing now in testing, and how is that playing out in week one?
So we're offering testing far and wide. So through the grant we've had with you all even back in the summer and in the spring when we had first returned to in-person learning, we made drive-through testing sites available for families, for staff, families, and students, so they could go for testing. And those weren't widely utilized at that time. We have kept those. We kept those sites, some of those sites open during the summer programming and did some testing. And so now that we're back to school, we've made testing very available. So we have 12 drive-through sites open in the evenings from 3 to 7 for families where they can go for testing. We have antigen tests at every one of our schools where school nurses can do on-site symptomatic testing. We developed protocols for that. They can also do 3 to 5 day testing for vaccinated employees who are now recommended to have a test done at 3 to 5 days if they're exposed and asymptomatic. And then, of course, through the federal funds that have come to the states, we're now doing weekly testing at all of our school and physical sites in Louisville that we are in the process of rolling out now. We're seeing an increase in uptake in testing. For example, we had 383 people utilize the drive-through testing sites alone yesterday. So there's a lot more utilization of testing by our families and staff.
That's great, Eva. Mark, over to you. What should parents and educators know about the Delta variant? And given all of the resources that have gone into supporting schools, including some of those that Ava just mentioned, do schools have what they need in order to safely reopen to them?
Well, Andrew, great to be with you all today. It's a very timely event, and it is a good news and bad news situation. The Delta variant is tougher. It's at least twice as transmissible as the previous versions of the COVID virus that we've had to deal with. And as a result of that, it is hard to keep from getting infected if you're in close proximity with lots of other people and not taking the steps that we know can work to reduce infection. That's why we're seeing such a big surge in cases, especially in unvaccinated people around the country now. This past week, there's something like 120,000 infections reported in children, probably lots more than that actually occurring, because fortunately for most kids, they do fine with the infection, no or minimal symptoms. But unfortunately, close to 2,000 hospitalizations for kids right now in the United States because of this surge. So this is something we need to pay attention to, both to prevent kids and families and communities from getting infected, to prevent some of the consequences that happen with COVID infections, including from the Delta variant. The good news right now, Andrew, is that we know how to deal with this, and we're going to hopefully have a chance to hear more from Eva and Dina about the things that they're doing. But first off, new this year compared to last year is that we have widely available, safe, and effective vaccines for adults and for kids age 12 and over. So the most important thing to contain the spread in the schools and in the communities is to find out about vaccination and get vaccinated if your pediatrician or your clinician recommends it. So we still have a ways to go on getting the vaccination numbers up, including in older kids. And right now, many school districts are requiring vaccination for their faculty and staff with exemptions for religious reasons or for health reasons. And virtually every other district is very strongly encouraging it. Teachers' unions are behind it. Very important step that can make school reopening safe this year. There is, along with that, a set of tools that work together to add to the protections of vaccination. This includes distancing, as we just were talking about, ventilation, taking activities outside like lunch and so forth when you can, keeping kids more in cohorts, and as we were just hearing about a minute ago, all of those kinds of things can help with reducing risk. And Andrew, a very important part of knowing where you are and helping to contain any outbreaks that do occur is testing. This is an area where we've made a tremendous amount of progress. You mentioned the Rockefeller work, the work that we've been pleased to be part of with Duke-Margolis in all of that. So we now have not only widespread availability of tests, but also a lot of knowledge about how to use those tests effectively for students to get tested, for faculty and staff to get tested as a part regularly, as a part of knowing where you are, and especially in areas with higher levels of COVID activity in the community, being able to detect outbreaks and manage them very effectively. Behind that, you mentioned that there is more funding available to support these efforts. Not every school has taken advantage of that yet, unfortunately, so we're not seeing as much use of testing and these other steps altogether, as I think would really help keep this pandemic under control for kids back in school. But there is funding available. There are now many good examples of how to do it, and I hope we'll get a chance to hear more from Eva and Dina about that.
Good. Thanks, Mark, and thanks for being with us since literally day one of the pandemic. It's amazing to have your support. Dina, I think, getting to Mark's point, we do know a lot more than we did a year ago about how to safely reopen schools, and we do know what those tools are, and we have resources to pay for those tools. But in New Orleans, what gave you the confidence to reopen? And what tools in particular gave you that confidence, in particular right now with Delta being so prominent across Louisiana?
Yes, thanks, Andrew. And I think that's exactly it. There's tools that we know now work, and we're just leaning on them to start the school year. So last year, just for context, we did open our schools in September, and we're open all year long except for one spike for a couple weeks in that January surge nationwide. And thankfully, what we learned during that time was that our schools can stay open. The transmission was not occurring on campus when, in fact, students masked universally. We implemented distancing and cohorting, and we did everything to make sure every other health protocol was in place at our schools. So unfortunately, our educators, were hoping this year would look different. But what has led us to open several weeks ago and where we are today is that we know these things work. We know the science behind these things work. We protected our community before, and we're hoping they will continue to protect our community, even given how much COVID is impacting Louisiana as a whole. So those are masks. Masks are in place, again, universally. Our students and staff rely on those, they welcome those, and they haven't been a problem since we implemented them in our schools last year or this year. Testing is something that we knew was vital last year, but we could not offer in a holistic way. But that essential tool has helped us open confidently this year because we know that testing will be available at all of our schools on a weekly basis for students to get high quality molecular testing. Our schools leveraged the antigen testing, the rapid testing for symptomatic last year. So that's a tool they now know how to use and they're leveraging as needed now. And we just know that that resource is thankfully due to the federal resources going to be there consistently in a way that we can count on. That's one of the hardest challenges when you're trying to open schools in these moments is what resource can you bring to bear that you can count on? And knowing that that resource will be there for our whole entire community to access is huge. And third is vaccines. As another tool we're leaning on. This summer, we started doing vaccine drives among our summer schools and started to learn how to bring vaccines to students. And a key part of our effort in New Orleans has always been to ensure equitable access to all of these tools to protect them and their families. And so we are now beginning a mobile drive in partnership with our mayor and other philanthropic partners and some medical systems to do mobile vaccines for our students and staff. The majority of our staff is vaccinated across our schools. And also a step that our schools have taken in particular, we are not mandating it yet for students, but students participating in any extracurricular activity, our high schools have all committed of sports or after school activities have to become vaccinated, which is leading to a whole sort of new wave of students taking control of their health and seeking out the vaccine. So we're opening, with a sense of knowing that we need to be cautious and monitor the data, which we always are doing on a regular basis to understand how COVID is working in our schools. We do have COVID now in our schools based upon our testing efforts that we can see, but right now at this time, it's a reflection of community spread, and we haven't seen transmission yet occur on site. But we know we have to remain vigilant. But these tools, masking, testing, and vaccines, is just something that helps us know that we can move forward to the point that we've seen in the RAND research that our families want school in person, our students want school in person, and we know that that's the best place to serve them.
That's incredible, Dina. And I just also love the partnership that you have with the health department on this and your school board. I think one of our early partners was with Dr. Jenna Vigno, the health department director, and she's been, I feel like, the champion from day one on all of this. So it's awesome to see that partnership continue. But maybe going back to Heather and the report that was released this morning, and reviewing that, I think for me, one of the most striking results was the variance in attitudes among racial lines. That 82% of Black and 83% of Hispanic parents plan to send their children back to school in the fall, compared to 94% of white parents. And non-white parents were also more focused on having mitigation measures in place, such as the ones that Dina was just talking about with ventilation and testing. So what guidance do you have for educators who are concerned about students of color and then falling further behind in the pandemic?
Yeah, well, as I was listening to Dina talk, I think the good news is that especially Black, Hispanic, and Asian parents are clearly communicating that they want the tools that Dina was describing. That's exactly the things they want to feel safe. And we had asked on the survey, what would it take to make you feel safe sending your children to school in person, allowing them to pick all of the measures that they prefer. And 5 of them rose to the top. 2/3 or more of Black, Hispanic, and Asian parents wanted all 5 of the following things to feel safe. The first and topmost is classroom ventilation. And that could mean propping open classroom doors, not necessarily HVAC replacements. They wanted teachers to be vaccinated. They wanted 3 feet of social distance. They wanted mandatory masking. And they wanted routine COVID-19 testing at schools. So most of the things that Dina just mentioned is an exact hit on what parents were saying that they wanted. So my advice to schools and to districts is to clearly communicate to parents, not just we're following CDC guidelines or we're following state health guidelines, sort of generic broad statements like that, but instead to say we have a suite of measures in place and here they are, and list them out, spell them out, and say how it's happening. Because I think we also found in the survey that only 27% of parents said that they knew detailed information about their school's safety practices, but yet 60% of parents said that they wanted to know more. So there is demand there. There's a desire on the part of parents to have more information, and so it's excellent when the very things that the schools are doing is what especially unsure parents want in order to feel safe sending their kids to school.
Great. Thanks, Heather. And just a reminder for folks listening in, you can submit your questions on social media. We want to make sure that this is as interactive as possible, given the large global audience. So please do submit those questions. Ava, over to you. I think we've been having a lot of conversations over the past year about your efforts in Jefferson County, and two issues that keep on coming up are transportation and contact tracing. And the majority of your kids take the bus to school, often across great distances that require, often kids getting on more than one bus in the morning and in the afternoon. And it's obviously not a challenge that is unique to Jefferson County. But what are you doing to ensure that students can safely get to school and that the buses are not a source of transmission? And relatedly, you talked a little bit about the stay apart and keep it chart slogan earlier in the conversation. And I was talking a little bit about quarantines earlier in the conversation. And what are you doing to track cases and to limit unnecessary quarantine times in Jefferson County?
So yes, our biggest challenge without a doubt is the busing, because in Louisville, years back when desegregation occurred in the city, a unique busing system was set up that makes it a big challenge because kids do get on more than one bus at a time. And at the start of school, I think every district can relate to not knowing for sure who's going to be at the bus stop and trying to figure out who's riding the bus, who isn't riding the bus. We had some unique challenges last week when school started, even because so many parents showed up in the drop-off lines to drop their kids off to school because they didn't want to put them on the bus. But that created some challenges that I think exceeded the expectations of the schools a little bit. So those are all important things to keep in mind. We have an incredible partnership with our health department, which I think has been critical to the work that we do in Jefferson County. And since we started, I have met with a team from the health department at least weekly. Sometimes we meet more than once. The health department created kind of a dedicated team, a team internally that specifically focuses on the schools. Of course, we have some private schools in Louisville as well, and so they work with the private schools also. But we have back and forth communication with them about cases and contacts. And so we work very closely. So contact tracing is a big part of that. And what we did a couple of things. We put nurses in all our schools, and their primary role is contact tracing. And so they help facilitate that work at the school level. And so that is very critical for us to be able to be appropriate in the kids that are being quarantined. We have guidelines for quarantine, and we're sticking to those guidelines as far as the definition of close contact. To help mitigate the situation on the bus, of course, students are all required to wear masks on the bus, but our buses are pretty full. They'll hold up to 66 students. And so we're asking them, of course, to keep a chart, a seating chart, so we can know what students were within 6 feet of others. And we're working again with parents to really help them to know that the weekly testing is available, and to encourage parents, especially those who have children who ride the bus, to take advantage of having that opportunity. We're really trying to approach this from a community perspective. It's going to take all of us to keep our schools open, and it's very important for everyone. And so making that testing available is very important. The appropriate contact tracing is important, but then working with our community partners to do it appropriately is also very significant.
And maybe just a follow-up question on that is, how are you paying for those school nurses? It's amazing that you have a school nurse in every building. And I think we talked a little bit before about a safety and school officer in each building. How are you paying for that? And is that going to live after the pandemic?
So we made a request to use some of the ESSER funds, the federal funds that came to school districts. I submitted a budget request to fund nurses when we looked at putting a nurse in every building. Prior to the pandemic, we have over 160 schools, about 155 of those are brick and mortar, and we had less than half of our schools had any regular nursing care. So with the pandemic, we brought on 100 nurses to help support our schools with the contact tracing in particular. So federal funds were used to do that. And what we'll do, a few years ago, the federal Medicaid, school-based Medicaid program revised their stance on school-based Medicaid billing, and it is called expanded Medicaid billing. It expanded what services could be billed in school districts. And so our nurses that aren't funded through the ESSER funds, the non-federal funds, will be billing for services. And so with an eye on helping to create a sustainable model moving forward to retain those nurses post-pandemic.
Great. That's amazing. Thanks, Eva. Mark, over to you. You've been very focused on this K-12 question since the beginning of the pandemic. And I believe it was in the fall, maybe in October, where we actually partnered and put K-12 protocols together with Caitlin Rivers and colleagues at Duke and JHU at a time when there was little guidance. But many of the major constraints that we faced last year, issues we talked about related to funding and access to tests, are no longer a challenge. So what would you say are the main constraints now, and what can be done to overcome them? And then, are the protocols in place that we need to reopen schools now, or do we need any further guidance?
Well, Andrew, I think the main constraints now are really just taking the actions needed to do what we know works and what we're seeing in many places around the country to help contain the spread that's happening in communities now, affecting kids and families and all of us, and to make it possible for this safe reopening that so many parents want to see happen. So before I fully answer that question, I did want to go back to something that Heather and Eva emphasized, which is that on the one hand, we're seeing a lot of cases right now as schools are reopening, and that's because it's not the schools, it's the transmission that's happening in the community because of Delta being so easy to transmit, and that's affecting a lot of individuals and families across the country. So understandably, families want to see these steps implemented in schools so they can be confident about being able to send their kids back, about not having quarantines that would keep kids home for weeks and so forth. So we're going to see a lot of cases at the beginning of school everywhere. The question is, can we implement these steps effectively and widely to prevent that kind of spread from happening? What we saw last year was that schools that implemented good measures, and we've got even better measures now, were able to reduce the risk to children compared to being out in the community or at home. So this is really done right, is an important step, not only for safe back to school in person, but also for helping get community rates of spread affecting kids down. And in terms of being able to do it, as you said, we've developed some protocols at Duke-Margolis and the Rockefeller Foundation. They're available online that you all supported and that have been the foundation for a lot of steps that specific schools have implemented. There's some guidance from the Centers for Disease Control as well, but it still, I know, is pretty imposing for school districts and school principals and other leaders that haven't actually implemented these full programs. With respect to testing in particular, though, we have some good protocols and supports that work, as well as funding, and there are lots of examples around the country of districts that are doing this, ranging, coast to coast, Los Angeles, New York City, New Orleans, Louisville, as we're hearing about today, El Paso, many parts of the country that have high rates of COVID are showing how to reopen successfully using these tools. And for testing in particular, there now are a number of what you might call end-to-end test providers, so that if you're a school administrator and you don't know really where to start in terms of all of the consent documentation, the scheduling, the test administration, which either is nasal swabs or saliva or spit tests, shipping those tests out, getting the results and reporting the results back, documenting, acting on them. You don't have to do all of that. There are other organizations that you can contract with that will take care of all of those steps. And the main thing for schools to think about is, as you're just hearing, having a school nurse in place who can help oversee all of this. Maybe having, a lot of schools have safety officers now that help with managing these and the other steps that schools are implementing, so that everybody else at the school can focus on what they need to do. They have to get tested, but getting their education, teaching the students, doing all the normal things that schools should be doing to catch us back up on our education activities in this country. Cost should not be a barrier for this at all. As you've heard from the other participants here, they have taken advantage of federal funding, in some cases state and local funding, to support all of these programs. The federal government's allocated to states over $10 billion for testing in particular this year through their so-called ELC programs. And the federal government's also allocated more than $120 billion to support this broad range of safe reopening steps. Unfortunately, not every district is fully taking advantage of those steps yet. So that's why what we're doing today is so timely. It is possible to do, and there are lots of good examples of how to do it, as well as a lot of guidance available.
Thanks, Mark, and just thank you for your leadership throughout the pandemic and just constant advice to us. Um, Dina, over to you. One of the big takeaways from the RAND survey that Heather talked about earlier today is the importance of communication, proactively engaging families. And a lot of families in the survey responded that they don't feel like they have enough information about what is happening and what changes have been enacted to make their schools safer. How are you doing this in New Orleans, and how has the approach changed with the introduction of the Delta variant?
In the broader
Dina,
public.
I can't hear you. Okay, there we go.
Can you hear me
You were
now?
on mute. Yes, now we can hear you.
Sorry. We're deploying lots of different tactics to communicate with families. I'm not surprised by that data. It is always our challenge to make sure the nitty-gritty details get to our parents, which is unfortunate and hard at times. But a few things that we've leaned on at the start of this school year and are continuing to work on are, one, just sort of really transparent and frequent communications with the public around things like we have a COVID tracker. So we have on our website. So there's some tools that we're deploying so that families can access information about their school-based health, around how many cases are in their buildings. That's something we update weekly in an effort to be truly transparent with families and making sure they can access that information. Our superintendent also hosts weekly press conferences. We started this about 3 weeks before school started, and we're continuing to do it so that families and the public, and also our press, who then create the newspaper articles that then get into families' hands as well, can hear about what we're doing, what the status of things are, and answering questions directly that we're hearing from our schools around what's needed. We also are trying to have very frequent and aligned messages through social media, both through our social media, our school-based social media, and with our partners at the city. We have a great partnership with our mayor. Cantrell has been an amazing leader for us here in New Orleans, and we want to make sure that all the messages around what's happening in schools, that they're open, what we're doing to keep students safe is something we try to push out across lots of channels in the community, given that families listen to different pieces. But then what we know is the most reliable source of information that we learned last year is making sure our schools have the best information that's in very clear and concise, bite-sized information that they can then turnkey and share with their families. So that means creating standard messaging and standard materials that they can put into their weekly newsletters and their weekly social media events to help families access that. I also think word of mouth, or having families speak one-on-one. So what we've been encouraging our schools, if families are confused or they call the district, we answer their questions, but encourage them to connect with their school. Because if a family's concerned about their child's safety, the best person to help them understand what's happening at the school and how we hope to keep their child safe every day is their school leader or the school nurse. As Ava said, all of our schools in New Orleans have nurses as well. And so it's always a challenge to reach 45,000 families, which is who we serve in New Orleans, in a very specific way. But we're trying to deploy all of those tactics to help continue to hammer home very simple and clear messages about what we're doing and how we're trying to be transparent, too, about what's happening in our schools.
Hey, Andrew.
Yes.
May I jump in on this one just to tag on to something Dina said? We did ask on the survey from who do you most trust for information about your child's school's safety practices, and not surprisingly, school principals is number one. 44% of parents selected that. So I'm just basically underlining Dina's point about turnkey short messages that schools can then issue out without having to recreate the wheel and write all their own messaging, which is time consuming, and schools often lack the staff capacity and time to do it. So providing schools with texts that they can use and push out, especially from the school principal, could be a good way to help assuage parents' concerns and to keep them up to date.
Great, thanks Heather for that addition. We'll go to some questions. We're getting a lot of questions from the audience, so let's take some of them. I think that the first question that I'm seeing is there are a lot of federal and state dollars available for school testing, but it doesn't seem like a lot of that is floating. What is holding up dollars for schools who want to access it, and how can we convince schools that haven't yet adopted testing to do so? So maybe we'll go to the schools to hear from them about any challenges or what they're doing with the resources that are available. Maybe Eva first, and then Dina, and then Mark, if you want to chime in with anything else.
So what I would say first is, we had an opportunity through the Rockefeller Foundation to really pilot testing and what testing models could look like in Jefferson County. So I think that helped us to really understand more about testing and how it can be utilized and how it can work. In Kentucky, the state issued the RFP for vendors to do the testing. So they've set the model up so all that we have to do is work with state vendors. So I want to say for us in Louisville, we have 3 testing options available for our families. So one is the screening testing, and that's done through the federal dollars, and that has happened through our state who made those dollars available. The on-site antigen testing for symptomatic students that are and staff that our nurses are doing, that has come through funding we've gotten in conjunction with the Rockefeller Foundation, and we're looking for ways to sustain that beyond that funding period. And then our drive-through testing sites also have been funding through the Rockefeller Foundation. And what we're seeing so far, of course, we've just been here for a week, but with the screening testing, we've done nearly 2,000 tests since last week, and we've had 5 positives. So in our asymptomatic population, not very many positives. Our drive-through testing sites, though, are much heavier. They're being utilized more, as are our symptomatic test sites at the schools, because that's a different need that parents have. And so accessing those dollars in Kentucky has been because of what the state has done to help set that up and make it easier for schools to utilize.
Great, Eva. And Dina, over to you. Are you able to access federal resources for your efforts in New Orleans? Do you have any challenges there? If not, how is it working?
Yeah, we are. So I think it's always good for everyone at the local level to never stop asking questions of your state government around what you need. But we are very fortunate that we are beginning to do our weekly school-based testing based upon those federal dollars that have run through our Department of Health at the state level. So they are offering, as Mark mentioned, end-to-end, which was something that we learned last year was necessary as we tried to hobble together testing of our own. But they are offering end-to-end testing through local providers for our schools starting in a week. We are actually still continuing doing that testing through the Rockefeller work and funding that we've received. So the federal dollars are supporting our efforts, and we're very grateful for them.
Mark, anything to add on to that?
And just would reiterate, ask your state. The state programs differ a bit from state to state, but all of them are paying attention to these issues, and all of them have funding available. On testing in particular, there's also a federal program, Operation Extended Testing, which may be able to provide some direct support, especially for more vulnerable school districts that have had trouble getting the resources they need.
Great. Thanks, Mark. Maybe Mark, we'll stay with you on the next question as the medical doctor here. There is some evidence of outdoor transmission, not common but possible. Should kids and adults wear masks outdoors in certain circumstances?
It really does depend on the circumstances, and I think the ones that are probably most concerning are the ones where you'd have kids together, lots of kids, lots of adults together in close quarters for an extended period of time. So, think about the high school football game this fall, or another event that brings lots of people together. In those cases, masks do really help. Just would emphasize too that we know a lot more, and we have a lot more availability of masks as well. And those that are a couple of layers of cotton, those that are closer to the N95 or KN95 level of protection do better, especially with transmissibility of the Delta variant. But for other types of outdoor activities where you're out in a park, you're not that close together, that the kids have some room to run around, I don't think masks are nearly as critical.
Okay. Great. Thanks, Mark. I think that we have another question here around this communication question that keeps on coming up, and that really came across strongly in the RAND survey. Is what is the best method to help parents get the information they need in a informed, they best understand to take all of these precautions. So Heather, maybe over to you first, and then we'll hear from Dina and Ava about what they're doing in Louisville and New Orleans.
Sure. Dina and Ava will have more expertise than I and lived experience about what does and doesn't work. But I can say that we did ask these parents in July, like I said, from whom do you trust this information about school safety measures? And school principal was number one. Interestingly, and that was across the board for most, not all parent subgroups that we asked. Interestingly, Black and Hispanic parents ranked the local health department as their top choice. So that was kind of an interesting divergence. And I think points to Dina, I think it was Dina who was saying, or maybe it was Eva, about the need to go through multiple channels. I mean, we all know that not all parents read just one email. It needs to be repeated, it needs to be in bite-sized chunks, and it needs to come from several avenues, whether it's robocalls, emails, tweets from the school, any other types of venues that local health departments and schools are issuing. But I would stress that I think the messenger that most parents are looking to is the leader of the school building, as opposed to necessarily the leader of the whole school district or a state health official or even a local health official, with the exception of Black and Hispanic parents. But Dina and Eva, I'd love to hear what your guys' experience tells you about how to best communicate with parents.
Well, I would just reiterate, I think it is all the different channels, right? Every family sort of relies on a different tool, reading the email, the tweet. Many of our schools rely on text message more than anything now to reach families. So it's very efficient and sort of quick, and can go in different, and can be sent right away. So text messages, emails. I do think, there's some tools too. We created some checklists for families that we're pushing out again. We created last year, but sort of a thing to say, you're sending your child to school, right? Ways to help prepare and be mindful, and different ways you can do that to help families, because in reality, our families are another tool in protecting our schools, right? Because if their child is feeling sick, then hopefully they don't send them to school, which is really hard as a parent, given all the other challenges that we're faced with. So we're making sure the parents have the tools and information that they need to make the right decisions. And I also think, families who really care deeply about their safety and rely on masking, I would encourage those folks to reach out to their school boards. Most of all these decisions come down to your school board. As Ava mentioned, school boards have a lot of power to set their own standards. We set our own masking mandate last summer before school started, before our state set it at our school board level. And so those entities really have the power to impact what's happening in your school. So I encourage families who have specific concerns that's where, at least within our experience, decisions can be made. Encourage folks to share their concerns with them.
And I would add just, with in addition to the things we've discussed with the media and the website, when we have a case in any school, there is a notice that goes out to all families that there's a case in the school, that goes from the principal to all families, and that gives them some information, encourages them to watch for symptoms, gives them the link to some resources. And so that's been one venue. We have a dashboard on our website that parents can reference. We use our school nurses a lot to talk to families. I think that's significant to have that relationship with families. I think that's why we see principals as being a trusted communicator, and I think we can develop those same kind of relationships using our school nurses and other support staff that can help in that role. We did lots of clinics over the summer, and we did those clinics to offer free sports physicals, and we use that as a way to get families in and to be able to talk to them about vaccines, but it also let us talk to them about other strategies that the schools were using, things that we would do to help keep kids safe. Our administration, our superintendent and school board has been very supportive of the having a layered approach and mitigating factors. And so to echo what Dina said, the school board has a lot of control over what happens at the local level. And I think when people understand that this is, I also tell everybody we want to keep COVID out and students in. And so we can argue about the political aspect of this all day long, which is what people are doing. But at the end of the day, kids need to be in school. And in order to be in school, we have to figure out how to do it despite COVID. And so communication with our families and building that trust is critical to make that happen.
Right. Thanks, Ava. I like that phrase, keep COVID out, keep students in. I think that should be our national aspiration. I also want to encourage people to actually look at the survey, the RAND survey. Will students come back? It's on our website. You'll be seeing it in various news sources throughout the day. But it's a very helpful resource, so I encourage you all to look at that. I have one final question for the panelists, and then we'll wrap. You all have really, each of you has taken a national leadership role throughout the pandemic and fighting the pandemic since the very beginning, working on one of the most consequential, at times confusing, and all too often polarizing tasks, getting our kids safely back to school and averting further learning loss. So what gives you hope for the coming semester? And Mark, I think we'll start with you and then go to Heather, Eva, and then Dina to round this out.
Well, it's a great question. I actually am pretty hopeful right now. You know, we're at a tough time in the pandemic in the United States. Very high case rates in the midst of a surge, high rates of hospital occupancy, and at the same time, we're trying to reopen schools and get back to normal because people are so frustrated with how disruptive the pandemic has been. I think here are some reasons for good news looking ahead, for being optimistic looking ahead of the fall. One is, there's some indications that this surge that we're facing now may be peaking in a number of places, including in Louisiana that's been really hard hit. That gives us some hope that there'll be fewer cases out there in the community as schools are trying to reopen. But on top of that, I want to go back to what we've just been hearing from even others about keeping COVID out and students in. This is so important. I think it's going to be a motivator for several things to happen. Number one, more people are going to take a close look at vaccination and choose to get vaccinated. It's going to matter for participation in school sports. It's going to matter for helping to support these schools in reopening. The more people that are vaccinated, the less COVID we're going to have. And then number two, all of the steps that we've talked about today, they have shown that they can help bring down case rates below what they are in the community. They've shown that they can prevent the quarantines, the other disruptions that are otherwise going to happen if we don't take these steps. So this is not as straightforward as just being done and you know, trying to go back to fully to normal, but we know what works. And if more schools take the kinds of steps that we've heard about today, including from Eva just now, the steps that are being taken in Louisville and in New Orleans, we'll be able to reopen, get kids back into education. And on top of that, it's going to help control COVID in the rest of the country too.
Thank you, Mark. Heather?
I'm going to echo Mark. We're not in the same place now that we were last year. We have a lot more tools. We have a lot more information. And I'm encouraged that there's alignment from this parent survey between a demand for the very things that we know will help contain transmission in schools. So I think that there's a lot to be hopeful about. I do think, you know, I know that masks have become much more politicized than in last year, but I do think that this survey shows there is strong demand for a whole suite of safety measures from parents. And so schools can respond to that demand and help keep our kids safe and in school.
What keeps you optimistic in Louisville, Eva?
I'll tell you what keeps me optimistic and gives me hope is yesterday I got to go out to an elementary school and watch the screening testing happening. And there were all these young kids, diverse population of kids waiting to get their test and talking to them. They are thrilled to be at school. They are so happy to be there. And then I was really struck by the fact that I was watching, first of all, healthcare be normalized and self-care be normalized because these kids were getting the opportunity to take control of their health. And what gives me hope is that maybe we'll use this pandemic as an opportunity to change the way we do business in the United States. And we'll look at some of our structural inequities, and we'll see that, that schools are the place where we can reach most children, and we won't tolerate ignoring some of the disparities and things that existed before. So seeing children is powerful, and seeing them in school and knowing that's where they need to be, and that the greatest disparity of all from this will come if we don't educate them, because that is the biggest thing that's going to impact their long-term health. And so we have to have them in school, and we've got to make that an imperative to have them in person and stay there.
Thank you, Eva. Dina?
Eva just said it all, but I would add, I think one thing that makes this year sort of a different place than we were a year ago are the resources available to our schools to protect themselves against COVID-19 and support our students educationally, right? So a year ago, we didn't have federal resources for testing. We didn't have extra ESSER dollars to ensure that schools have staff or resources on hand. And so there is a great source of resources now available to schools, which helps you know that we can get through this. But I think the broader source of optimism is the resilience of our students and our educators that we see every day in our schools in New Orleans, that everyone is committed to, one, being in school. Students desperately want to be with each other, and that gives me hope that they'll keep doing their part to stay safe. And that also the commitment of our educators to know that they need to be there to serve our students is just so invigorating, and therefore brings me that we'll just keep fighting this together. We can only keep moving forward. And I'm encouraged that schools around within where I live and others are continuing the path forward. We're not turning back, because we know we can't turn back unless we really have to, which if there comes times where we have to make harder choices, we will. But I'm optimistic about the fact that we aren't there, and people are only talking about opening schools, not keeping them closed.
Great. Thanks, Dina. And thanks to all of you for your just incredible energy, enthusiasm, and level of insight that you've given this challenge over the past year. And thanks for everybody for joining us today. I think we had nearly 100,000 people on the call. I hope that you all found this to be practical and a productive use of your time. I think two phrases stuck out for me in the conversation. One is keep COVID out and keep students in, and we know what works. And so we have the models. Let's use them. And I think we can look to Louisville and New Orleans for examples of how we can keep students in. So thank you all for your partnership, your guidance, and somehow your optimism over the past year and a half. It's been amazing to have you all as partners, and we're very proud to be your partners at the Rockefeller Foundation. I also just want to encourage people to look at the RAND report online. It's available as of this morning. I think there's a lot of rich data in there that will help you navigate some of these issues. And thanks again to everybody for joining us today, and enjoy the rest of your day. Thank you.